This is a revolutionary news from the medical science. Human patient put in the suspended animation for the first time. This suspended animation is a technique in the medical science in which the patient is first of all made dead by lowering the body temperature, and after some time the patient is again restored to the normal state. This technique can be very much useful in the surgeries, in those surgeries in which excessive blood loss can occur, due to which the oxygen deprivation of the tissues causes the death of the vital body organs. So this technique can be very useful for the doctors, especially the surgeons. What is suspended animation? How is it useful in the medical science? Suspended animation is the temporary slowing or stopping of the body functions, biological functions of the body in a way that it causes no harm to the physiological functions of the body. Recently, doctors in United States successfully placed humans in the suspended animation for the first time. The technique is medically called emergency preservation and resuscitation (EPR) and has been tested at the University of Maryland Medical Center on the patients with the acute trauma such as stab wounds or gunshot. With EPR, the patient is cooled rapidly by replacing their blood with ice cold saline. The heart of the patient stops beating and the brain activity almost completely stops. After the surgery is over, the patient is warmed, blood is repumped in the body to restore the patient to the living state. Now, what is the use of this technique? How this technique can be useful for the doctors? At normal body temperature, the cells need a constant supply of oxygen to remain alive. But the cold temperature slows or stops the chemical reactions in the cells. As a result, the cells need less oxygen or no oxygen. As the oxygen requirement for the cells remain nil or negligible, therefore doctors can perform the long and risky surgeries without fear of oxygen deprivation of the vital organs of the body. This happens in the surgeries when excessive blood loss occurs or blood pressure of the patient becomes too low. This technique can give more time to the surgeons to perform risky surgeries and can increase the chances of survival of patients in such surgeries.